Okay, today I want to talk about something called insulin resistance. As the term implies, insulin resistance is a condition in which your cells become resistant to insulin. This is a very widespread problem, and it can cause a lot of metabolic problems. As a matter of fact, recent studies have shown that only 12% of Americans are metabolically healthy, meaning 88%, I'll repeat, 88% of Americans are not metabolically healthy. What that means in the long run is they're susceptible to various degenerative diseases, especially metabolic related diseases, including cardiovascular disease and type 2 diabetes. But insulin resistance comes into the scene because it's a forerunner of these many metabolic problems. They did a survey in 2021. Last year there was a survey done by a couple of researchers. They surveyed 6,000 young adults between the ages of 18 and 44, and they showed that 40% of them had insulin resistance. 50%, and not only that, but if you read articles or you look at videos where some people talk about insulin resistance, they often mention that it's associated with obesity. In other words, having enlarged fat cells. That's called hypertrophic obesity. What that does is it kind of decreases the sensitivity of the fat cells to insulin, and it basically makes the cells or the body cells resistant to insulin. A lot of it has to do with a substance called tyrosine kinase, which is involved in interaction between insulin and the insulin receptor. I don't want to get into that, but suffice to say that having enlarged fat cells definitely predisposes you to insulin resistance. As a matter of fact, most people who have higher body fat levels are in fact insulin resistant. But this is an interesting point. 50% of those who have insulin resistance are not obese. They have normal body body fat levels. So in other words, you can have insulin resistance and not even know it. What are some of the symptoms? Well, if you could check your blood glucose, consistently high resting blood glucose, which is meaning over 100. Normal blood glucose levels, resting blood glucose levels, meaning away from a meal, the normal levels are anywhere from 70 all the way up to 100. However, the ideal blood glucose level for health and longevity is actually in the low 80s. Even better if you can get in the 70s. However, I will say this, and I know this from personal experience and observing many others. If you're engaged in exercise, if you consume a high protein diet, if you're taking a lot of the branched chain amino acids, leucine, isoleucine, and valine, it's going to be very difficult, even if you're lean and muscular, to get a resting glucose that's consistently in the 70s. Most medically healthy people have the blood glucose level that's between, let's say, 80 and 85. 90, it starts to veer in the other direction. There are some studies that show that having consistent resting blood glucose levels above 90 causes a slow brain degeneration. It sets you up for diseases such as Alzheimer's disease. In fact, well, I don't want to get into too much tangential material, but there's a protein or an enzyme called insulin degrading enzyme. And as the name implies, this enzyme works by breaking down insulin. And it works in the brain because insulin does get in the brain. However, if you eat too many carbohydrates, refined carbohydrates, if you have a poor diet, another function of insulin degrading enzyme in the brain is to remove abnormal folded proteins such as tau and beta amyloid, which are considered the causes of Alzheimer's disease. In other words, insulin degrading enzyme actually sweeps the brain of the garbage that can cause brain disease. But when you take in too many carbohydrates, the insulin degrading enzyme has to break down all the excess insulin that exists, doesn't get a chance to sweep out the bad proteins, and because of that, Diabetes and even insulin resistance is sometimes called type 3 diabetes, meaning it's specific to the brain and causing brain degeneration. So that's just one of the problems with both insulin resistance and diabetes. How do you know you have elevated, insulin resistance? Well, there's certain signs. There's something called I think it's called there's a certain skin condition. I don't remember the exact medical term, but it's like darkened skin. You see it around the neck, around the armpits. You get these skin tags. And of course, as I said, you get resting high blood glucose levels. Any resting blood glucose level between that's over 100 and up to 126 is considered pre-diabetes or insulin resistance. Once you reach a resting blood glucose level of 126, that's considered full-blown diabetes. It can also be measured by a test called glycolated hemoglobin. Anything over 5.7%, between 5.7 and 6.4% is considered also insulin resistant. Anything over 6.4% is full-blown diabetes. Glycated hemoglobin is a good test because it measures the way your body handles glucose over an extended period of several months. So in other words, your blood glucose can go up and down all the time depending on what you eat, your physical activity, but the hemoglobin A1C basically tells you how your body's handling glucose over an extended period. And most physicians look at that as a better indicator of both insulin resistance and impending type 2 diabetes. Now, what causes insulin resistance? Well, there's many factors. There's a genetic factor. So there's certain genes that predispose people to having insulin resistance. This probably explains why people who don't even have excess body fat levels can have insulin resistance. It's because normally it's almost always associated with having elevated body fat levels. But there are a lot of people, like I say, half the people that have insulin resistance do not have elevated body fat levels. They probably have the abnormal genes that predispose them. Age. As you get older, there's a greater tendency towards insulin resistance, especially if you have a genetic background. Now, speaking personally, I have no other way to speak. Anyway, speaking for myself, I have an extremely strong, if you want to call it, strain of diabetes incidence in my family history. My father had diabetes. He died of diabetic complications, specifically congestive heart failure. Both my grandfathers had diabetes. I've been a lifelong weight trainer. I'm not going to say bodybuilder because to me that implies competition, and I haven't competed in 50 years, but I was a competitive bodybuilder. I've always been active as far as exercise. I've tried to follow a good diet. So the good news is I have not developed full-blown type 2 diabetes. But I can tell you this, I will make a flat statement. I've told this to my friends. If I ever stop exercising and start eating badly, I will probably develop diabetes within 2 to 3 weeks. How do I know this? Because there's been occasions where I've laid off my workouts, normally when I'm not working out, I'm not that active. I don't do a lot of running and stuff like that. I don't run at all, as a matter of fact. Most of the time I'm sedentary, I'm writing, I'm researching. So, without exercise, my genetics start to take over. And I start to show much higher blood glucose levels, which means I'm heading for diabetes. However, as long as I'm working out, I keep my blood glucose levels in check. Again, I eat a moderate protein diet, and most of the time, I keep my resting blood glucose between, let's say, 83 and 93. I'd rather have it in the 80s. But some days, I'll have a little extra protein, or if I eat a little bit too late at night, it'll go into the 90s. Very rarely does it go over 100. It only goes over 100 when I eat really refined carbohydrates or stuff like pizza. It will, if I eat pizza, let's say one day, the next day when I check my blood glucose when I wake up, it'll usually be as high as 110, and that's because of the pizza. Pizza has a weird effect on blood glucose levels because, as you know, it's composed of bread, oil, and cheese. Now, the cheese, of course, contains protein. The bread is a carbohydrate, but the oil and the protein actually delay the entry of the glucose from the bread into the blood. It's a delayed effect. So when you eat pizza, the elevated blood glucose doesn't show up until as much as 8 to 12 hours later. In other words, it doesn't. When you eat pizza, because of the oil and the fat from the cheese, it delays the rise of glucose. Pizza is one of the only foods known to do that. In fact, they wrote a medical journal article a couple of years ago warning diabetics about that effect of pizza, that it causes a delayed elevation of glucose. So what scientists think, for most people, the actual cause of insulin resistance is thought to be two main factors: a lack of physical activity, and I'll explain more in detail about that later, and also a accumulation of visceral fat. What is visceral fat? Visceral fat is deep-lying abdominal fat. You can't see it. The type of fat you see, for example, if you don't have prominent abdominal muscles, the fat that's covering your abdominals is what they call subcutaneous fat, or fat just under the skin. You cannot see visceral fat. It's deep-lying abdominal fat. It lines your internal organs, your lower abdomen. Visceral fat is by far the most dangerous type of body fat because it's very labile. What that means, it's constantly being broken down, and the fat is released in the bloodstream. It goes to the liver, and in the liver, it basically is converted into, it is triglyceride, but the excess release of fat from visceral fat stores travels to the liver and tends to cause fatty liver. Visceral fat is a cause of both insulin resistance and fatty liver. Fatty liver, also called, there's two kinds: alcoholic fatty liver and non-alcoholic. Most cases are non-alcoholic, meaning it's people that get a fatty liver without drinking alcohol, and that's usually from a lack of physical activity combined with an excess intake of refined carbohydrates, particularly a high intake of what they call high fructose corn syrup, which is processed fructose. Consuming large amounts of that very readily is converted into triglycerides, or fat in the liver, and it can cause fatty liver, non-alcoholic fatty liver. Another name for insulin resistance is, they call it pre-diabetes, because the elevated blood sugar, resting blood sugar, which is indicative of insulin resistance, is considered a forerunner to type 2 diabetes. Now, does this mean that people with insulin resistance will always develop type 2 diabetes? Absolutely not. Absolutely not. What it means is that if you have insulin resistance, you definitely are at increased risk for developing type 2 diabetes, especially as you age. But you can keep yourself from developing type 2 diabetes even if you're insulin resistant by engaging in diet and exercise. My personal experience tells me, and so do the medical studies underscore this, that the best way from a point of view of exercise to control insulin resistance and keep your blood glucose levels lower is a combination of both aerobic exercise and resistance training or weight training. You really have to do both to get the maximal effect. You can do aerobic exercise alone. They've shown in studies that just one session, get this, one session of aerobic training, maybe 30 minutes, 20-30 minutes, actually lowers insulin resistance by 16% for 24 hours. And in some other studies show it can decrease insulin resistance for 48 hours. They used to think that only aerobic exercise was useful in helping to control insulin resistance, but in the last few years they've shown that weight training also has a definite effect in controlling blood glucose and also in helping you to control insulin resistance. Why is that? Because when you work out, Normally, one of the functions of insulin, and most people know this, is to push glucose into cells. That's one of the functions. It has many functions. It also helps to, it helps to push amino acids into muscle, and that's kind of an anabolic effect. It helps to your body to synthesize glycogen. I'm not going to go into all the functions of insulin, but suffice to say that when you work out, your muscles can uptake glucose circulating in your blood without having to need insulin. How is this possible? Because the muscles, there's a thing produced when you work out in muscles. It's a glucose transporter protein called glucose transporter 4, shortened to GLUT4. When you work out, you stimulate the release of GLUT4, and GLUT4 can transport glucose directly into muscles, and that has an effect of lowering elevated blood glucose, and a secondary effect of, because of the lowering of blood glucose, it also helps you control insulin resistance. And this is how weight training helps to prevent diabetes and control insulin resistance. Now, one of the problems when you're insulin resistant is that because your body cannot, or your cells, I should say, cannot properly use insulin. Of course, that's what it means by insulin resistance. Very often, as a side effect, you get a condition called hyperinsulinemia. That means excess insulin. Excess insulin is a real problem because it's associated with elevated blood triglyceride levels. Triglyceride levels are the fat in the blood. They used to think that blood triglycerides really weren't that important in relation to cardiovascular disease, but more recently they now know that elevated blood triglycerides are a precursor for the production of low-density lipoprotein in the liver. Low-density lipoprotein, when oxidized, is a key factor in causing atherosclerosis, or basically a buildup of plaque in the arteries, which is thought to be a direct cause of heart attacks and strokes. So having elevated insulin caused by, a consistent elevated insulin, that's hyperinsulinemia, because the insulin goes up and down. And of course, when you eat a meal, if it contains carbohydrates especially, or even protein, your insulin's going to go up, but it goes down again. It's a temporary thing. That's not hyperinsulinemia. Hyperinsulinemia is where it stays high. That's where the danger comes in. Besides causing high triglyceride levels, hyperinsulinemia is associated with, as I said, atherosclerosis development and also hypertension or high blood pressure. And this is something to also consider as a tangential statement here. I just want to add those bodybuilders and athletes who like to use insulin as an anabolic drug. They usually take it with anabolic steroids and growth hormone. Consistent use of insulin is a kind of artificial hyperinsulinemia, especially if you use it several times a day. And what you're doing is actually causing damage to your arteries that's going to eventually cause severe cardiovascular disease. Adding to the effect is the use of anabolic steroids, which inhibits nitric oxide production, which also helps to protect your arteries. So when you take insulin and steroids, you're having a double whammy effect of really messing up your blood vessels. And they now know that vascular aging is probably the number one cause of cardiovascular disease that occurs with aging. In other words, when I say vascular aging, I'm talking about a loss of elasticity in the arteries, where the arteries get very stiff, and that has a lot to do with the buildup of plaque or atherosclerosis, and insulin is involved in that. That's just something to consider. And another thing for you bodybuilders, competitive bodybuilders, not all of you, of course, but some of you who like to take growth hormone, you should know that growth hormone causes severe insulin resistance. Severe insulin resistance. Why does it do that? Because one of the features of growth hormone also is the same reason why it causes insulin resistance. Growth hormone promotes the release of fat from fat cells, but it causes a huge release of free fatty acids in the blood. And free fatty acids compete with glucose for uptake into cells, and that causes insulin resistance. Now, strangely enough, a lot of bodybuilders take insulin. As I said, if you take insulin with growth hormone, the insulin will actually counter that effect, but then you have the problems with insulin that I just mentioned. So I also now want to get into a couple of things that you can do to improve your insulin sensitivity. One thing that's often overlooked by many people is sleep, and I've talked about sleep in prior videos. A lack of sleep increases your risk, it lowers your immune response, it increases your risk for cardiovascular disease and type 2 diabetes. I recently, this is just another anecdote I'm going to throw in. I recently contracted, about a little over a month ago, I contracted COVID-19. And I'll tell you how it happened. I avoided COVID-19 for over 2.5 years. I didn't get it. I was very careful. I wore the mask in public. I avoided getting too close to people. I kept away from crowds. Even when I trained, when the gyms closed, I trained at a private training gym by myself, so I wasn't exposed to anyone else. For those reasons, I didn't get COVID-19. So how did I get it? Well, I went to a bodybuilding contest at Venice Beach, and I had 2 masks in my pocket, but nobody was wearing a mask, and I saw all these people I know, so I didn't put on my mask, which was very foolish. And I was close to people, but I think the main reason I got it was besides being exposed to obviously somebody who had the infection, or else I wouldn't have gotten it. But I think a key reason why I got it is because to get to that contest, I had to wake up very early, and I didn't get to sleep. I only had, to make a long story short, 2 hours sleep. So when I got to the contest, the lack of sleep, my immune system was gone. I had basically the combination of low immunity and then being exposed to COVID gave me COVID. And that's just an example of what happens when you don't get enough sleep. Now, related to insulin sensitivity, a lack of sleep can, even in a healthy person, get this, if you're a healthy person, lean and in good shape, even one night of not enough sleep will make you insulin sensitivity. It will make you insulin insensitive. One study featured 9 healthy volunteers, and they found that getting 4 hours of sleep significantly reduced insulin sensitivity and the ability to regulate blood sugar compared to another group that got 8.5 hours sleep. So anybody, no matter what your health status, if you don't get enough sleep, you will be insulin sensitive. If you catch up on the sleep, you could, it's not a permanent thing. If you get enough sleep the next night, you'll be okay. So not enough sleep is a cause of insulin insensitivity. As I mentioned earlier, exercise. I think the reason why so many people are, I'm talking about, again, the surveys show 88% of Americans are metabolically unhealthy. I think a lot of that relates to a lack of physical activity. A lot of people don't move enough, they don't walk enough, they sit around playing with computers or on their cell phones, they don't exercise, and exercise is absolutely vital for for increasing insulin sensitivity. Again, the exercise, when you work out, you immediately increase insulin sensitivity that lasts anywhere from 2 to 48 hours, depending on the exercise. One study found that 60 minutes of cycling on a machine at a moderate pace increased insulin sensitivity for 48 hours, 2 days. And as I said earlier, resistance training also increases insulin sensitivity. You only have to work out for maybe 40 to 50 minutes to get the full benefit of weight training for insulin sensitivity. And again, with the relation to an exercise and insulin sensitivity has to do with that GLUT4, that glucose transporter that pushes glucose into muscles where the glucose is oxidized rather than accumulating in the blood. So a study of men with who were overweight but who didn't have diabetes found that when they performed resistance training over a 3-month period, their insulin sensitivity increased even if they didn't lose any weight. That's how powerful insulin. As I said earlier, my experience myself being insulin resistant, in my case, it's due mainly to genetic factors. I didn't develop insulin resistance until I was over 55 years of age. Never had it before then. As I said, it's a strong component in my family. It is related to genetics. But in my case, I've experimented. Like some days I will do only weight training. The other days I'll do weight training and then followed by aerobics. I find I get a much better control of my blood glucose levels when I do both weight training and followed by aerobics. I'll train with weights for about an hour, followed by about 30 minutes of aerobics. When I check my with a glucometer, when I check my resting insulin level the next day, that's when it gets to be great, like 82, 83, perfect. That's the level that actually prevents a lot of disease and is very good for longevity. Another thing you want to do, I know this is hard, I've written an article in my Applied Metabolics about this. You want to reduce stress. Why do you want to reduce stress? Because when you're under stress, you get the release of what they call fight or flight stress hormones. And what happens is these stress hormones, they break down stored glycogen, which is a stored form of carbohydrate in the liver mainly. It's also stored in muscles, but with the hormones that break down the stress hormones work on liver glycogen, and this causes the glycogen to break down into glucose. Glycolysis is called. It elevates your blood glucose, and again, that could be related to insulin insensitivity. One of the main causes, as from a hormonal viewpoint, besides growth hormone, elevated cortisol. Cortisol is an adrenal steroid released during stress conditions. Unfortunately, cortisol opposes the effects of insulin in lowering blood glucose. So having consistently high cortisol levels actually will produce insulin resistance on its own, and it also favors the development of body fat in the torso area. You get this increase of fat in the chest area especially, and also it increases visceral body fat, which, as I said, is the worst kind of body fat. So you want to control stress, maybe engage in meditation. Exercise is a great way to control stress. That's my personal way of controlling stress. Exercise has always helped me under stressful conditions. And of course, sleep. You got to make sure you get enough sleep. As I said earlier, obesity is more closely associated with insulin insensitivity, and the majority of people that have excess body fat are insulin insensitivity. So what you want to do is try and lose excess fat. So especially, as you lose body fat, you will reduce visceral fat. As a matter of fact, the good news about visceral fat, as I mentioned earlier, it's very labile. It's constantly being released. But because of that, it's also a bit more prone to oxidation when you work out. So when you work out, the very first type of fat you will lose is visceral fat, which is the fat most associated with insulin resistance. So, trying to lose some body fat will actually help reduce insulin resistance. A study at Johns Hopkins University found that people with pre-diabetes or insulin resistance who lost 5 to 7% of their total weight over 6 months reduced their risk of type 2 diabetes by 54% over the next 3 years. That's what I meant when I said having pre-diabetes or insulin resistance doesn't mean that you're going to develop type 2 diabetes. You have the power to prevent that through exercise and diet. Another thing you want to do, eat more soluble fiber. There's two kinds of fiber, soluble and insoluble. Insoluble is great. It helps prevent stuff like constipation, keeps things moving along. Soluble fiber, however, does a lot of different things. For example, it combines with stuff like cholesterol, helps you get rid of cholesterol out of your body. It also feeds the intestinal microbiome, which is the population of organisms that reside in the colon that have a myriad of health effects. I've talked about it in other videos. I've written about it. I'm not going to get into here, but let me put it this way. Eating soluble fiber by affecting the intestinal microbiome actually helps you control your blood glucose level by causing the release of what they call short-chain fatty acids, which are released by certain bacteria in the microbiome. There's 3 of them: acetate, propionate, and the other one's butyrate. And butyrate itself can actually prevent the development of colon cancer. And among other things, like I said, it helps your pancreas, release insulin more effectively. A study that involving 264 women found that those who consume more soluble fiber had significantly lower levels of insulin resistance. What foods are rich in soluble fiber? Beans or legumes, oatmeal, flaxseed, and vegetables like broccoli sprouts. Most fruits also have a good amount of soluble fiber. Speaking of fruits, you want to eat more fruits and vegetables because, and I've written this in my Applied Metabolics, fruits contain elements called flavonoids, polyphenols, and various other substances that you don't find in over-the-counter supplements. They're only found in these foods. These have antioxidant effects. One of the reasons why diabetes and insulin resistance is bad is because, this is one of the reasons, it increases oxidative insult or oxidative damage in your body. And the natural antioxidants found in fruits and vegetables help to neutralize the free radicals, which are the elements that cause oxidative damage. Studies have found that eating a diet rich in these plant compounds is linked to higher insulin sensitivity. As a matter of fact, there's a substance in apples, specifically apple peel, not the fruit, it's in the peel. This stuff is called, it's a little hard to pronounce, I believe it's called fluoridazine. Fluoridazine is found in apple peel, and believe it or not, they just came out recently in the last couple of years with these drugs called glucose-like peptide agonists, which kind of, they give it to diabetics, and it helps to control blood glucose levels. Of course, any drug has side effects, but the interesting thing is this stuff, this fluoridazine that's found in apple peels, it actually helps your body get rid of excess glucose. In other words, it works exactly like the prescription drugs, except for one thing: it has no side effects at all. So when the adage about a doctor a day, an apple a day keeps the doctor away, has some element of truth. Another thing that you want to do to decrease insulin insensitivity or insulin resistance, you do want to reduce carbohydrates. Now, this is a kind of a contentious issue, because there's a lot of pseudo experts, I call them, on the internet that downplay the effect of carbohydrates and insulin. I've seen statements where they say carbohydrates cannot make you fat because your liver oxidizes excess carbohydrates. I'm sorry, I can't help laughing. It's so obviously wrong. All these people walking around eating processed carbohydrates, they're fat as a house, and you're telling me carbohydrates don't make you fat. Give me a break. Insulin definitely stimulates body fat accretion, and the worst kind of carbohydrates to eat, as I said, are processed carbohydrates. And when you reduce your carbohydrate, you automatically increase insulin sensitivity right away. Not only that, the type of carbohydrates you want to eat or basically focus on are lower glycemic index carbs. These are carbohydrates that, when they're eaten alone, they have less of an effect of stimulating or increasing your blood glucose levels and stimulating insulin. Typical low glycemic index carbs are sweet potatoes, brown rice, quinoa, and some varieties of oatmeal. Because of anything with soluble fiber will usually have a low glycemic, and you want to keep away from refined carbohydrates. As I said, look for added sugars in foods, especially if you buy supermarket foods. Read the labels. I've seen products that have like 4 different kinds of sugar. The other day I was in a supermarket. I was looking for a natural peanut butter. What I mean by natural is I wanted a peanut butter that contained just peanuts. I don't want anything else with peanut butter. Well, I looked at about 7 or 8 brands, and all of them contained sugar, and one of them contained 3 kinds of sugar. What the hell? Why would you add sugar to peanut butter? Of course, I didn't buy these, so you got to read the labels carefully, and you want to be careful of processed foods, because a lot of them contain high fructose corn syrup and table sugar, also known as sucrose, and sometimes listed as dextrose. These things are mostly highly refined carbohydrate processed foods. Now, eating small amounts of high fructose corn syrup is probably harmless, especially if you are active, because you'll burn it up as energy. The problem is, if you eat a lot of these type of refined foods, you're going to get an accumulation, or you're going to be eating a lot of high fructose corn syrup. That's when you're going to get into trouble, because then it's going to be turned into triglycerides in the liver. It's going to cause fatty liver and insulin resistance. Fructose in large amounts can cause insulin resistance. The effects of fructose on insulin resistance can even affect people who do not have diabetes. An analysis of 29 studies that included a total of 1,005 people who were moderate in weight and who were moderate weight or and overweight or had obesity showed that the higher intake of fructose did lead to insulin resistance. Consuming a lot of fructose over less than 60 days increased liver insulin resistance, independent of total calorie intake. Certain spices can help control blood glucose. Fenugreek contains a type of, I'm trying to remember the name of it. It's a certain amino acid. I wrote about it, 25 years ago. But it's a certain type of amino acid found only in fenugreek that actually helps to lower blood glucose, and it also stimulates glycogen synthesis, which is very good for bodybuilders and anyone else because it helps you increase your glycogen stores in the liver. And fenugreek seeds are soluble fiber themselves. Turmeric also contains curcumin. Curcumin has anti-inflammatory properties, and it seems to increase insulin sensitivity by reducing free fatty acids and sugar in the blood. Ginger, the spice ginger has been linked to increase insulin sensitivity. The component of ginger that does that's called gingerol, and it makes glucose receptors on muscle cells more available. So probably by affecting GLUT4, which increases glucose uptake into muscle. Garlic has been shown to increase insulin secretion, and the antioxidant effects of garlic can also reduce some of the bad effects of insulin sensitivity. You hear a lot about cinnamon. Cinnamon is often recommended as a way of controlling blood sugar or blood glucose and increasing insulin sensitivity. One meta-analysis, which is an analysis of a bunch of prior studies, found that consuming 1/2 to 3 teaspoons or 1 to 6 grams of cinnamon significantly reduced short and long-term blood glucose levels. They think that cinnamon works by increasing insulin sensitivity through helping receptors for glucose on muscle cells become more available and efficient at transporting sugar into cells. Other studies have found that cinnamon contains compounds that can directly mimic insulin. Now, I have tried cinnamon. I've taken it many times. I've taken 6 grams, the full amount. And I'm not going to say it does nothing to help control glucose, but in my case, it had very, very minimal effects. Very minimal effects. And as I wrote recently in Applied Metabolics, some emerging studies show that eating large amounts of cinnamon can actually stimulate body fat accretion. So I'm not really big on cinnamon, but I'm sure that a little bit won't hurt, but it's not great. Another great supplement that will help control blood sugar is green tea. An analysis of 17 studies looked at the effects of green tea on blood glucose and insulin sensitivity, and they found that green tea significantly reduced fasting blood glucose and increased insulin sensitivity. They traced it to the powerful antioxidant in green tea called epigallocatechin gallate, or EGCG. Many studies have shown that to increase insulin sensitivity. Another easy way to control blood glucose is by taking apple cider vinegar. If you take apple cider vinegar right before a meal or during a meal, it will actually increase insulin sensitivity by reducing, slowing the uptake of sugar or starch from the meal, and this helps you to control the blood glucose level. One study found that people consuming apple cider vinegar increased insulin sensitivity by 34% during a high-carb meal in people who were insulin resistant and 19% in people with type 2 diabetes. However, I strongly suggest that you dilute the apple cider vinegar. Take it with let's say 1 or 2 tablespoons of apple cider vinegar. Take it with about at least 4 or 5 ounces of water. If you take the apple cider vinegar, you get a reaction, which actually happened to me once, right? Just down straight apple cider vinegar, and it immediately caused a reaction in my breathing tube where it contracted. It felt like almost like having a piece of meat stuck in me. I couldn't breathe. I thought for sure I was going to die. I said, this is it, I'm dead. I couldn't get any air in. Luckily, thank God, it opened up a minute later. Never did that again. As a matter of fact, it freaked me out so much. I've never taken apple cider vinegar since then because it really freaked me out. So again, there's some supplements that are said to help control blood glucose and by doing so decrease insulin insensitivity. These include chromium. Studies have found that chromium at doses of 200 to 1,000 micrograms could improve the ability of insulin receptors to reduce blood glucose. However, more recent studies show that if you're taking chromium, you've taken more than 1,000 micrograms, it has a reverse effect that actually increases insulin insensitivity. Magnesium is very, very good for controlling insulin sensitivity. That's why I take magnesium separately from my other supplements. It works with insulin receptors to help the body store sugar. Several studies show that having low blood magnesium levels is associated with insulin resistance. A really good supplement, which I started taking a couple of months ago myself, is called Berberine. It's a plant molecule. It's extracted from herbs. It's a plant called the Berberis. Nobody knows exactly how it works, but they think that it stimulates a protein called AMPK, which is known to not only help your muscles utilize fat as fuel, but it also helps your body to utilize glucose. In fact, berberine, you could say, is the natural form of a standard drug given to people with insulin insensitivity called metformin. If you show up with blood sugar abnormalities related to insulin insensitivity, the first drug you'll be prescribed is metformin. I'm not going to go into metformin in this video, but suffice to say that there's quite a few studies showing that metformin may actually be a longevity drug. It does a number of other things that favor longevity. I'm not saying everybody should take it. About half the people that take metformin get gastrointestinal distress. They can't use it. I've been using metformin for, I think, about at least 18, 19 years now. Never once have had any problems with it. I've never had any gastrointestinal problems, nothing. I don't take a lot. I take 500 milligrams twice a day. That's it. I don't want to take more than that because if you take more than 2,000 milligrams of metformin, it will interfere with the effect of exercise, health benefits, and also may actually interfere with testosterone synthesis. So I keep it to 1,000 milligrams a day. Some people believe that taking metformin in any dose will interfere with exercise benefits, so they actually will not take metformin on the days they exercise. I think personally that's bullshit. As I said, I've taken it for 19 years, and if metformin would have interfered with exercise benefits, like for example, blood glucose control, whatever, or muscle growth, I would have noticed it. I have not noticed it. I don't believe that crap. Resveratrol is another supplement that helps to increase insulin sensitivity, especially if you have really elevated blood glucose or if you already have type 2 diabetes, but nobody really knows exactly how it works. Oh my God, this is a 42-minute video. I wasn't looking at the clock. This is the longest one I've made in years, so I'm going to end it right now. So I didn't mean for it to go this long, but I wanted to really, give you the full kitchen sink, like they say, about insulin sensitivity, because I think it's a really important topic, especially since so many people have it who don't even know they have it, and they're going to get into big trouble, especially as they get past the age of 40. So I'm going to stop now, and I'm going to tell you, if you want more information on nutrition, exercise science, anti-aging research, effective fat loss techniques, ergogenic aids, hormonal therapy, women's health and fitness, ergogenic aids, I think I might have said that, and many, many other topics. I cover more topics in my Applied Metabolics than any other digital publication that I know of, and nobody can match my 60 years of experience and study. Nobody come close. I don't care if they have 30 PhDs. They can't match what I have learned over the years, and all of that's included in Applied Metabolics. I absolutely guarantee that no matter what your level of education, if you subscribe to Applied Metabolics, you will learn something in every issue. It's a monthly publication. It comes out on the first of the month, when you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on medicine, nutrition, and exercise science. I also have an email portal on my Applied Metabolics webpage where current subscribers only, I don't accept unsolicited questions, can send me short questions about something they might have read in Applied Metabolics or anything else that comes to mind, as long as they're short questions. I won't answer, if you're not a subscriber, I will not have time to answer your question. I'm sorry. You're welcome to leave comments under these videos, for example, suggestions for topics topics that you'd like me to cover in a video. I know that I'll always get troll comments, but that's okay. I'm just gonna ignore them. I don't care what the trolls say, because the trolls have mental problems. And I don't remember, some famous guy said made a statement to the effect that if you engage with a stupid person, you will actually become more stupid yourself. So I don't engage with trolls. So I know that's not going to keep some of the schmucks from leaving bad comments. My favorites, I love this stuff when they say, "Why listen to this guy? He doesn't even look like he trains." I mean, that's such a stupid, retarded statement that it requires no explanation. Only a bonehead moron would say something like that. I'm not going to get into it anymore. Sorry about that tirade. It's just, these people are so stupid, they nauseate me. Anyway, that's about it. So thank you for listening. And if you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. Take care.